It was really amazing. I'm alive, clearly, but I'm living.
What does that mean?
I wake up and I'm happy every morning. I'm happy and I feel like there's another day. There was a time when I thought that I was always going to wake up miserable. I was always going to wake up in pain. There was never going to get any better. Because I've always been told I have an incurable disease. I have a limited life expectancy. I've limited time with my mother. But it wasn't true. It was never true.
Welcome back. That was a great story with Ryan that we just had. It was wonderful. Our next guest says, after numerous attempts to help with the excruciating pain of a rare disorder, medical marijuana has allowed her to cope and even thrive in her daily life. Give Josey Scoggin a warm welcome, please.
Can I sit?
What's that?
Can I sit down?
Yeah, of course.
Thank you.
Of course. No, you can't stand. I just stood for you. Thank you for coming.
Thank you.
I appreciate it. Tell us about what's been going on. So you've had what kind of disorder do you have that's causing you to have all this excruciating pain?
I was diagnosed with progressive pseudo-rheumatoid spondyloepiphyseal dysplasia, which is a disease, an autoimmune disorder that attacks the cartilage between my joints. In addition, I have a problem producing calcium, so my bones are incredibly fragile. It shortens my life expectancy. I was thought to be paralyzed by 18. I will celebrate my 20th birthday next week.
Yay! So you're a fighter. I
have a life expectancy of about 30. My mother
We expect to see you here at age 40.
We're hoping so,
on the
yes.
show, right? Absolutely.
My mother was diagnosed with the same disorder when she was 21 years old. They were told her that she was never supposed to have children. By 19, she had me. They told her she was going to be paralyzed before she was 18 and dead before she hit 30. But they also told her that this was never going to be passed on to her child. It's never been passed from a mother to a daughter, and it's never been passed from generation to generation. So when I was diagnosed, my mom, it was a 2-week process of me losing my ability to walk.
2 weeks.
2 weeks. I woke up and my legs felt like jello, and I couldn't move. I remember when it first started happening, I just felt horrible. Like I was achy and I couldn't go anywhere. My mom was like, I was 12 at the time, and I was in 7th grade, and my mom wanted to take me into the doctor. So when I went in there, they diagnosed me with the same disorder that my mother has. And they had started pumping me with a lot of narcotics. And because of my mom originally did not want me to be using Oxycontin or fentanyl or morphine or anything like that. But originally, there was this huge thing called medical neglect. And by not offering me any freedom from my pain, she was being threatened with CPS.
So just so you understand what's going on, because she refused to give her these narcotics, which could also have lots of side effects, they said that she was neglecting you, or
yes, medical neglect.
Yeah,
neglecting my medical needs. And so my mother didn't have a choice but to allow them to experiment on me. And I was given fentanyl patches and morphine patches and Oxycontin out of, and I was about 75 pounds when I was in 7th grade. And I would get sick every morning at school, but I still had to go or I would get truancy.
You'd throw up, right? You'd be nauseous.
I'd throw up every morning.
And that's a side effect of these medications that they said that was going to help her.
Yes. They told me that if I was in as much pain as I described to them, that nausea shouldn't be as big of an issue.
Whoa.
But I wanted to focus on school. I wanted to get through. I wanted to be a normal middle school girl. So in 2008, there was this huge buzz that there's medical marijuana law. My mom, she celebrated her 39th birthday last Monday.
That's awesome.
So she's beautiful. And I couldn't figure out why she's lived so long and why she's not sick. I always figure my mom's sick.
I know why.
And well,
I totally know why, because she's a fighter and she advocates for herself and you. But please go on.
So when the Medical Marijuana Act went through, she decided I no longer needed to be on narcotics. There was no way that she's going to watch me cry and throw up and fight with me over taking them. So
because you didn't want to take those medications.
No, I didn't.
Sick.
I remember being terrified that I thought that this is what it felt like when you were dying. Like, I was so sick and I just thought I was never going to get better. It was never going to get better. So in 2009, we finally were able to apply for medical marijuana cards. My mom signed me up the second she could, and I was the first registered medical marijuana patient here in Michigan. Minor medical marijuana patient.
So minor medical marijuana patient.
It was really amazing. I'm alive, clearly, but I'm living.
What does that mean?
I wake up and I'm happy every morning. I'm happy and I feel like there's another day. There was a time when I thought that I was always going to wake up miserable. I was always going to wake up in pain. There was never going to get any better. Because I've always been told I have an incurable disease. I have a limited life expectancy. I have limited time with my mother. But it wasn't true. It was never true.
Yeah, because you have an amazing attitude, doesn't she? Yeah, amazing attitude. There's something very interesting. You said I was living, but I wasn't alive. You know, and so you can pump yourself full of drugs that make you sick. You're living, but you're not living a life. And so
yes.
You know what? It may not be your first option. Everybody here that's been on our show that used medical marijuana said, listen, we used medicine. We don't not believe in pharmaceutical options, but we want to make sure you realize that at home or here, that medical marijuana can be an option that helps those medicines and helps you not just, like you said, not to just be living, but alive. I feel like, I bet your mother is like a duplicate of who you are.
Oh,
and you said
beautiful. She's
beautiful 3 times now, and I bet you she's beautiful as you are beautiful. And thank you for joining us and telling your story. Hi everyone, I'm Dr. Partha Nandi, and if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.